Hello friends. On this occasion of World Cancer Day, we are honored to have Dr. Anil D'Cruz, sir, who is the surgical director of Apollo Group of Hospitals across the country. Dr. Anil D'Cruz, sir, is the most renowned head neck cancer surgeon in the country as well as in the world. So it's been our honor to be here today on the launch of EDUCAN 2.0. Anil D'Cruz, sir, is the former director of TATA Memorial Hospital, Mumbai, and he is the president of UICC. So I'm going to hand over the mic to Anil D'Cruz, sir. He's going to talk about how dental professionals are important and why the course is going to help not only to the dentist but also to the society or the rural population of our country.
Thank you, Shakti. Thank you for having me to say a few words. I must congratulate you and Bhakti for taking the initiative on a very, very important topic, a topic that's important to our country and a topic that's very dear to my heart. It's important to our country because the irony or the paradox is that we are known as the capital of oral cancers. Of all cancers globally, oral cancers, half the cancers occur in our part of the world. So what message can I give to the dentists? So let's go step by step and see what the dental professional can do. One, they can counsel patients to stop the tobacco habit. They can not only counsel patients who come to their clinic, but also relatives who have this habit. It will prevent the cancer. They can help us in early detection of this cancer. If you detect an oral cancer in the first stage, the cure rates are upwards of 90%. We don't even have to wait for the first stage. Many of these oral cancers come in a pre-malignant stage. Malignant is cancer, pre-malignant before cancer, and they are just a pre-malignant lesion which is seen in the oral cavity. And that your dentists who are very well trained for, you all have an eye to pick it up, can pick these lesions up, which are white, pink patches, oral submucous fibrosis, and that can heighten the frequency of follow-up of our patients so that, God forbid, they turn towards malignancy, they can be treated, or when they're a high-risk pre-malignant condition, a high-risk leukoplakia, they can be treated. So you all are pivotal in prevention, you all are pivotal in early detection. You all are also pivotal, the maxillofacial group, in treatment. I have today at least 4 or 5 youngsters who train with me who are maxillofacial, who are very attuned to the anatomy, to the treatment of these cancers, and I'm just so delighted that maxillofacials are now taking the lead to treat these cancers as well. It's not only maxillofacials, other disciplines such as oral pathology can help in early diagnosis and various other subspecialties of the dental school. The fourth area that dentists are very, very important is in helping in the rehabilitation of patients. If a person has his jaw resected, the opposite side deviates, a simple prosthesis will keep alignment. We take out the maxilla, we need you all to give us a prosthesis to knot or to seal off the oral antral fistula. That's very, very important to rehabilitate our patients. Even if the patient doesn't need the prosthesis, a lot of patients are prone to dental caries, xerostomia, dry mouth, which predisposes to dental caries. Our patients need to have good dental prophylaxis before we start treatment, but more importantly, following the patient post-operatively to see that these patients do not get the dental complications, and should they get it, they are treated correctly and not precipitating osteoradionecrosis. So I think the dentists have a very important role in the quality of life of the patients. And the fifth and still more important area where you all can play a role is in the follow-up of patients. I operate a patient in a tertiary or in a quaternary care center. The patient goes back into his town, into his village, into his small setup. There's so many dentists all over the place. Good follow-up is essential. Many of these patients are prone to a second primary cancer. Some of these patients are prone to a recurrence. Again, totally curable if they're picked up in an early stage. So once again, that's the fifth place that a dentist can play an important role. So prevention, early detection, treatment, improving the quality of life of patients, and playing a very, very important role in the follow-up. I think you all have a very great and important role in our battle against oral cancer. So I want to congratulate the Asian Society of Head and Neck for this very important initiative, EDUCAN, the second module. Both Shakti and Bhakti were just telling me about their grandiose plans of having 3 modules, and I just wish this venture all the very best. I think it is an important venture, very, very important for our country. I leave you all with a message. Oral cancers is preventable. It's curable when early detected. I urge each and every dentist, you all look into the mouth of patients to treat dental conditions, particularly if the patient is a high-risk individual using tobacco and alcohol, and you do see a suspicious lesion, please send the patient to a specialist. If you are not doing oral cancers yourself and doing general dentistry, that will bring down the late presentation in our country and improve the cure rates. Once again, all good wishes to launch EDUCAN version 2. I wish the organizers the very best for this project, and I also tell the dentists who attend this that you all are fortunate that there are now groups who are doing these kind of programs for the help or control of oral cancer.
Thank you.